Assalamu alaikum. My name is Umayma Ahmed, and this is the presentation for our final year project. The topic of our final year project is detection of cone cut errors in dental Bitewing radiograph using CNN for quality assurance. And me, Umayma Ahmed, and my other groupmate is Mohamed, Moubarak, Mohamed Misbahou. And our project is supervised by Dr. Akim. And our project ID is 912R. Bitewing radiography is commonly used technique to detect caries in the interproximal area. The technique is widely used since the beginning year of dental students and dental assistants. It requires a learning curve to get clinically acceptable quality. Common errors in Bitewing radiograph among dental students and assistants include the cone cut damaged image. This study aims to develop CNN networks to predetermine cone cut errors to ensure proper images before a Bitewing radiograph is taken. This is necessary to implement a system that can detect this type of error, alert and guide the dental assistants before taking the Bitewing radiograph images. For our problem statement, dental problems nowadays are increasing as modern technologies have upgraded, so medical and dental sectors also have. Bitewing radiography is one of the X-rays used in dental sectors to detect decay between teeth and changes in the thickness of bone caused by oral or gum disease. During the radiograph process, a lot of the X-rays are wasted if the radiograph machine is not properly set, so dentists and medical students cannot get medical standard images. So a lot of the X-rays get wasted due to the procedure. The reason is to cut costs due to wastage of copies of images, and the purpose of our research is to detect the cone cut errors and get maximum accuracy level of Bitewing radiograph images through our system to prevent wastage and get clear and medical standard images.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mohamed Moubarak Misbahou Mkouboi, and my matric number is 1820705. So this is our final year project 1, and I'm going to explain about our project objectives and our project benefits. So for our objectives of this project, is to develop a convolution is to develop a convolutional neural network model to clarify cone cut errors from normal Bitewing X-ray images, which means that our data will based on X-ray images, and then we will take them and do a classification in order to do a classification between the good X-ray images and the bad ones. Move on to the next point, which is the project benefits. In this project, we will get many benefits. Among them, there is the benefits that will help to manage the hospital resources and fundings, and also will help to reduce the X-rays waste to the environment. And also we will decrease errors or mistakes of Bitewing X-rays, and also we will shorten the waste of time for both patients and staff, because if we use this project, the dentist will be able to diagnose or make good pictures, good X-rays in order to continue the diagnosed. But then there are some problems. Let's say the patient can do an X-ray session, and after that, the doctor call him after to come and redo it again because the pictures wasn't really clear. But for this project, we will help them to gain time. And to finalize, we have the we can minimize the wrong diagnosis, as I mentioned before.
For the significance of our project is Bitewing radiography plays a significant role in dental sectors. Due to failure to avoid horizontal overlapping while exposing Bitewing photos is one of the most frequent mistakes. For a few reasons, we can get cone cut errors, and as a result, it causes a lot of X-rays, wastage of time and money for the authority and patients. Also, it is waste of time for dentists and dental students. Sometimes wrong X-ray image may result in wrong diagnosis or treatment. Moreover, the amount of wastage it produces from the error X-rays, which are of no use, are thrown away as medical wastage, which is very harmful to the environment. Our main purpose of this project is to get the maximum level of accuracy in Bitewing radiography, to decrease errors and reduce the wastage of time and money for both dentists and patients, dental students, and help to prevent wrong diagnosis and reduce the wastage that is harmful to the environment.
To continue with the methodology, the first step is to select the data, which are some sets of X-rays images, and then move on to the second one is the data preprocessing. After collecting the data, we are going to do some pre-processing steps by using a Jupyter Notebook or Google Colab or Spider, Anaconda 3. And then we will try to clean the data if, let's say, there are some duplicates, and also remove the images or the data that we are not going to use later. After that, we will do the data modeling, which is to implement the CNN algorithm. And for this one, we will use the convolution layers. These are the techniques, and also the pooling layers, and also the flattened layer, fully connected layers, loss functions, and finally the optimizer. We select to do all this because we will want to have a good accuracy, and in order to improve our accuracy is to go through all these steps and add more features from the model. After that, we will go to the step number 4, which is the data evaluation. We will split the data into 2 sets, which is the test data and the training data. And then we'll take the training data and do evaluation in order to get the accuracy. And after that, when we get that, we'll go to the step number 5, which is the result visualization, which will see our progress about the model. Yeah. And also on this step, this is when the model has already learned about our process, and then we can do a prediction, or we can do some testing again.
These are some of the image and examples of cone cut errors. And as we can see, this is a normal radiography X-ray, and this is not normal. And as we all know that square cone cut errors occur when using a rectangular collimator. To correct a cone cut errors, the beam should be recentered towards the area of non-exposure, and improper assembly of receptor holding devices can also cause this kind of cone cuts. And cone cuts may be caused by various reasons, the most common being the image receptor is not in line with the positions of indicating devices, which is known as PID radiographic cone. And the collimator, which reduces the size and shape or cross-sectional area of the X-ray beam, doesn't completely exposes the film, and that results in cone cut errors.
To finish about this presentation, we are going to show you about our future work, which is to work with a big data sets in order to get more accuracy and also provide more efficiency about this model, and also finding better model to achieve better accuracy. As I mentioned before, on the methodology, we are going to go all through those techniques on the CNN model to improve our accuracy. And then we would like to build a system with our project, which means that if we finish this project earlier, we are willing to implement this on a real system in order to put it on tests in real life. And next, these are our references. And that's all for our presentation. And thank you so much for watching.